Welcome to Bonita's maternity program antenatal class. Today, Sister Talia will be chatting to us about dealing with blocked noses and snorties in your toddlers and your infants. Hi, Sister Talia.
Hi, everyone. Yes, so today we will be dealing with the all dreaded, it's this time of the year, the blocked noses and snotties. And I personally, as a mom, is going through it this time of the year, so I know it is quite difficult, but we're hoping to make the journey easier for you. So as the summer season ends, we normally have the increase of pollen and all those things in the air, and that we get the mucus-filled noses of babies and toddlers. However, we do have some tips to help alleviate this. And believe me, this is tried and tested tips for myself as well. So with the blocked nose, a lot of newborns or toddlers experience blocked noses, and it really deters their ability to feed because most of the things they do is nasal breathing. They don't really breathe through their mouth like we do. So a lot of times with the amniotic fluid, they swallow it during childbirth, and it goes up the nose as well, and that is what causes the congestion. Factors such as perfume, pet dander, fumes, smoking, those are all relevant to blocked noses as well as the common colds and flu. So what do we do? As moms, we avoid heavy perfume, especially because baby will be on our chest area. We avoid possible triggers such as pet dander. If you do have a pet at home, try and just wipe up all the little hairs and all those things often, vacuum cleaning. We keep the air moist by a humidifier. I believe in this in the kids' room or in the area where the kids are the most in. And this helps to prevent it because it helps moisturize the nose. We also keep babies under 3 months away from sick people. This is easier said than done, but we all have to try and do this. And if people come in contact with baby, to wash the hands, sanitize the hands, to avoid viruses and the spread of viruses. And then saline. This is the most fantastic thing to use. I like the Bennett's one as a mom. Because it's alcohol-free, the formula is great from newborn and to toddlers, and it can be used from birth. It helps to moisturize, soothe the nasal passages. So this is great before feeding. So before you do your breastfeeding or your bottle feeding, to put it in the nose, 2 drops or 3 drops, and it helps really to moisturize the passages, and it helps open it up so that baby can feed more easily. So runny nose with snotties. So we spoke previously about a blocked nose, but a runny nose can be just as much of a hindrance. So this is the way for our body to get rid of any viruses from entering the system. So it starts to run, and even when a virus enters it, it wants to get rid of that virus. So it normally is accompanied by some fever, coughing, or accompanying infection. So it's very important that we can clear the mucus, and we consider mucus normal and good. However, we do look at the color. Yellow, green, or cloudy is considered a sign of an infection. And if it's accompanied by a sore throat, congestion, coughing, or low-grade fever, we need to treat it because we don't want baby to be ending up very sick. Avoid heavy perfume when baby will be laying on your chest, as I mentioned previously, as well as with the congested nose. Monitor for possible triggers such as pet dander again. Again, we would do the humidified air. This is great not just for blocked nose, but also even for a runny nose. And 3-month-old baby, we again keep away from sick people. So we will also do the saline as mentioned earlier, but with the snotties, what do we do different? Need to get rid of it. So in the past, we used to send babies to hospitals. They used to be admitted for physio as well as suctioning. So with the graded device of a nose feeder, it's actually something I'm currently using on my 2-year-old as well now, as well as the Bennett's nose drops, because I have now one of those snotty kids running around. And it's safe because as you're pulling and you're kind of sucking the snot up, it's not reaching you. So it has a filter, it doesn't reach you, and it's a very safe, it's such a soft device to use on the nose, and you can use it from newborn. It really does make it a bit easier for you as a mom. You don't need to end up sitting at the ER for hours, going into hospital with your child, which is then more susceptible to other germs and infection. So you just replace your filter after every use, and you can wash with soap and water. Please know that when you're dealing with this, If your child at all should worsen, I always say when the fever gets to extent you can't treat it at home anymore, it's not coming down, your baby looks really apathic, tired, and baby's not drinking, eating, or thriving, even after all these treatments, please seek medical help, and please let us then know as Baby Line as well if you need any further assistance.